Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Spiro Manson, Distinguished Professor of Public Health and Psychiatry.
Thank you.
Thank you for joining us, Spiro.
Not at all.
Today's session was about suicidal behaviors and American Indian and Alaska Native, especially in the youth. We heard in the session how high the rates are, the suicide rates are for these youth. And it's tied to health equity. How is it tied to health equity?
Health equity means a number of things to a number of different people. I think of it in terms of access to opportunity. Often, and I think this is still characteristic in the field, our assumptions about risk of suicide, especially among American Indian and Alaska Native youth and younger adults, focus on individual deficiencies, lack of coping abilities, other types of personality, etc. I believe that, in fact, most of that camouflages the inequities that are afoot in terms of the opportunity structures in the communities in which we live and work. So that matters of poverty, matters of lack of employment opportunities, difficulties acquiring an education, dampen the aspirations that many youth and young adults have in our communities. And when you dampen those aspirations, it leaves you with a sense of hopelessness and helplessness.
So, as we heard in the session today, it really sounds like a comprehensive approach to suicide prevention is important. But we also know that it's important to bring in culturally appropriate prevention strategies. And you've had some success with that in your approach. Can you tell me a little bit about that?
Of course. When we talk about comprehensive approaches, it recognizes the fact that American Indian and Alaska Native youth and young adults live in many different worlds. Not only just white world and the Native world, but in schools, among their peers, within their families, within the broader community. And so the importance of marshaling our strategies that recognize the different worlds in which our young people live is the essence of comprehensiveness. My work has focused on one of those particular worlds. Dr. Laframboise, who presented just before me, focused on schools. Very important place where most American and Alaska Native youth live and work. So too is primary care. And as I mentioned in my particular remarks, there's a conspiracy of silence around suicide because of the stigma that frequently attaches to that and the disclosure of the risk related to that condition. And in primary care, the white coat phenomena, the very special contract between a provider and a patient, allows those conversations to emerge in ways that might not otherwise happen outside of such contexts, because the notion of threat, of being exposed exactly with respect to that risk of suicide, and the conversation that it occasions is much lower. And so this kind of a program, an evidence-based practice called Screening, Brief Intervention, Referral for Treatment, ESPERT, seeks to capitalize on that very special relationship and to use one's visit to the primary care setting as an opportunity to initiate that conversation, to build from there towards intervention.
I also heard in your presentation about the importance, how you've brought in traditional medicine as treatment options. Can you tell me a little bit more about the importance of that?
One of the lovely examples from each of the three programs that I described, which are not my programs I've consulted with and been privileged to have a partnership with. The detection of this risk of suicide is intended to provide readier access to the more biomedical tools that are available to us to reduce that risk. But they have all used this as an opportunity to increase the access that that individual at risk has with respect to the traditional healing resources that each has built into their own setting, as well as what exists out in the greater community. And the nature of those traditional healing resources varies regionally, as one would imagine, from one setting to the next.
From one tribe to the next.
Exactly.
Yeah, exactly. And can you tell me a little bit more about Dr. Framboy's work with the schools? She has done some phenomenal work about building problem solving and resiliency in younger Native American and Alaska youth.
It's seminal work. It's seminal for several reasons, and I've had the privilege of knowing Dr. Framboy for 3 decades. Although she's much younger than me, you'd never know. And her work really began to capitalize on, note that her program is called Life Skills Development. You don't see explicit recognition or a conversation about suicide early in the course of that intervention. And it's really about recognizing the strengths and skills and assets that all youth have, and particularly American and Alaska Native youth, and figuring out how to enable them to recognize that they possess those strengths and skills, and then enabling them to act on those, to build and enhance those skills towards improving their protection from suicide. And it builds upon this sense of resilience that's always been there in Native communities, but has not been recognized in terms of its potential until her work around suicide with Native youth.
Yeah, it's interesting when we were doing this session how a lot of the folks here in public health recognize the importance of working in schools. So it's very, very important work. And
it is.
Yeah, and her presentation is very interesting. So when we're talking about comprehensive changes, and comprehensive includes changing norms, what could you tell us about changing norms to prevent suicide?
That's a wonderful question. So when we talk about norms surrounding the behaviors that place people at risk, particularly young people, of suicide, what do? We usually cite statistics from the Youth Behavioral Risk Survey that indicates that 27% of youth in our middle schools and high schools have reported thinking about suicide and taking their lives within a 1-month period of time. Important, of concern, demanding our attention. But in Native communities, we're now pointing out that that means that 83% of our youth do not think that way. And so you're beginning to see movements afoot now within American and Alaska Native communities under the rubric of most of us, indicate that most of us don't have suicidal thoughts and or ideation. What is that about? How can we understand that better? What does that reflect under this notion of resilience and assets? How can we translate that into ways that those who are at risk can benefit and change the conversations that we have in our respective communities? So I think that that's one of the very exciting initiatives that are underway, not just in Native communities, but many communities broadly, but they have a particular resonance in Native communities because of this emphasis on strengths, resilience, and assets.
And gatekeepers?
The notion of gatekeepers is actually very, very consistent with life in Native communities. We talk about gatekeepers in the Native way of looking at the world in terms of individuals who will sponsor us for ceremonies of a variety of different kinds. For example, among the Navajo, there's the notion of the corn pollen path. Among the Lakota from the northern plains, that of the Red Road. Among my people, the Ojibwe or Anishinaabe from the eastern woodlands, the notion of peace Madadewan, which means a person of integrity. And what these refer to are developmental life courses, paths, if you will, to becoming a contributing member of one's community. And at each point in that developmental trajectory, there are specific individuals who are charged with helping us navigate that path, acquiring the skills, emulating the behaviors that are consistent with that. And they are the original gatekeepers. Gatekeepers with respect to health and wellness and that progression throughout the developmental lifespan. So this notion of gatekeepers that's come from the public health arena actually resonates quite well among Native communities. For the most part, in the public health arena, we think about it as teachers, as first responders, as primary care providers, as members of the faith community, et cetera. Well, those are just the counterparts to the spiritual paths that we've identified long ago that one wants to navigate in becoming a person of integrity. So.
Yeah. So if somebody wants to find out some more information about preventing suicide, where would they look?
It's a great question, because if you'd asked me this 40 years ago when I first entered the field, there was relatively nothing. I'm impressed that today that there's a wealth of resources. And at the end of today's presentation, I believe there are a series of slides that provide the viewer with immediate reference points. I have been privileged to be a part of SAMHSA, the Substance Use and Mental Health Services Administration's initiative on Garrett Lee Smith, youth suicide prevention, and the related initiative entitled Native Connections, which have focused very specifically on, one, the translation of evidence-based practices from the general mainstream to Native communities and their application in hopes of reducing the risk of suicide, and secondly, identifying these intrinsic strengths and resilience within Native communities and illustrating how our people have been able to build upon them and to codify them in ways that others can benefit. And so I think that those two initiatives particularly are especially important and relevant to the interested party.
Okay. And also, aren't there some from the Indian Health Service? And
there are. There's a special initiative currently underway for the last 8 years in the Indian Health Service that is of benefit as well. It's less well documented than those in the SAMHSA. So I think the best approach is to seek out all possibilities.
Yeah. Thank you so much for joining us.
My pleasure.
Yeah. And thank you so much for joining us for Beyond the Data. See you next month.